Healthcare on the Front Lines is funded by the Delaplane Foundation. Their philanthropy has spanned generations and is perpetuated today as a private family foundation dedicated to enriching lives through community endeavors.
Mission of Mercy is responding to a national health crisis.
Today, there's just such a switch, a change.
Folks who even have health care oftentimes cannot meet their deductibles.
There is a population of people out there falling through the cracks.
My mom had health insurance. She works 60 hours a week. Her health insurance, just for her, is $1,400 a month.
I had hepatitis C, and they wouldn't treat me. They sent me out the door because I can't afford a doctor.
They wanted me to go see specialists. I don't have insurance, I can't see specialists.
There's been so many controls put on, regulations. We have opioid crisis, anxiety, and more anger. Everything seems to have been escalating.
And then you throw the electronic medical record in there, and their doctor sits there at a computer, doesn't even hardly look up at them.
We're helping keep these individuals out of the ER, which is billions of dollars in expenses annually for our government.
Civil War was really the first time Americans had to respond to a healthcare crisis. The first time there were thousands and thousands of injured people. The first time that once those injuries occurred, they needed follow-up care.
And so now the situation is such that fewer and fewer people seem to be able to pay for medical care.
I think everyone should have the right to health care, no matter what your financial situation is.
There is a greater need, I think, for services for people who are not able to pay.
We can all be open more than 7 days a week and not meet the needs of those who are impoverished. Mission of Mercy was founded by a woman, Jonata Lone Sullivan, who was living in Arizona at the time.
So I was a very young professional climbing the ladders in my profession, and I was at the very peak of it.
Americans making a real difference, unsung heroes, confronting a problem, filling a need. That is what the Sullivans are doing.
They call this the Mission of Mercy. Mike and Gianna Sullivan, devout Catholics, say they were called by God to serve the poor.
God was trying to say, I don't want you to climb a ladder, I want you to ascend a mountain.
It was at that time when medicine was becoming a big business between the government involvement and the insurance company involvement. A lot of the things that drew young people into medicine were sort of being obscured and motives were being diluted.
She really received a spiritual call to restore dignity and heal through love.
When you have that conviction, you gotta work on it. You gotta do it.
We like to give historical context to the medical crisis that occurred during the Civil War, to be able to draw the line between what happened then, how the government responded, how citizens responded, and what's going on today in the front lines of the healthcare crisis.
Clara Barton is born in Massachusetts in 1821. Growing up in Massachusetts, she finds that she has a healing touch. She has a skill for assisting and caring for others.
Clara is a woman who's only 5'1" tall, a diminutive woman who shows this incredible amount of passion and dedication. She starts out coming into Washington, D.C. It's a new town. The Civil War is breaking out. It's a capital in chaos. She's trying to find her way. Next thing you know, the Pratt Street riots happen. Her boys from Massachusetts arrive in Washington, D.C.
And so she jumps into action. She tries to help them in any way that she can. These soldiers don't have anything that they need. They don't have food. Many of them don't even have weapons. Their uniforms are in tatters because of the fight that they've just been through. And the government does not have the capability of supplying them, of meeting their needs, of giving them medical attention. And so right there, in April of 1861, Clara Barton hears her calling. And that calling is to give these soldiers what the government and what the army is not capable of giving to them. Now, while she's trying to do that, her father dies in Massachusetts. While he's on his deathbed, she is telling her father about what she's set on doing, on helping soldiers, on going onto the battlefield. She also reveals the hesitance of the military in letting her go because she's a woman. And he writes back to her and says that if you feel what you are doing is right, then do it. Don't let anything stand in your way. And that really gives her the motivation that she needs and the drive to keep pushing.
There was no organized hospital system. There was no ambulance system. Those government organizations, those civilian organizations did not exist during the Civil War. Yet we responded. As a single civilian, Clara Barton responded to that crisis in any way she could.
And in the summer of 1862, she will be on the track towards becoming the angel of the battlefield.
She said, you know what? I'm going to do something about this. And she was able to bring in all these others to help her with her mission.
Well, we're trying to fill the need of, in some way, catching people falling through the cracks.
And we treat each person as if no one else, well, you saw us, as if no one else existed.
She actually started the legal entity of it in Arizona back in about 1990 and really got every door slammed in her face probably in Arizona that could be slammed in her face.
So they started out and they got an RV and they wanted to go to where the poorest of the poor were. So they started in the Emmitsburg area and started branching out. But they realized we can't do this alone. We're going to need churches probably as our sites.
All the people didn't come at once, but slowly and gradually it began. And then doctors and nurses and physical therapists and then dental services began, and more volunteers came.
Jonna Sullivan was inspired and driven to begin Mission of Mercy. And her husband, Dr. Michael Sullivan, picked that up. He picked up that same mission.
To be able to give those things away changes your whole perspective on medicine. It brings you back to those pure motives that may have called you into medicine in the first place.
It seems like it's the outlook, it's the passion. Some people have more of that passion. You need everybody as part of the puzzle.
Certainly, we do function as an adult internal medicine clinic, but at the same time, we feel that we do more than that, and people need more than that. And on a given day, the most important tool for a given person may be the kind voice, the eye contact, the touch. All of those things may be just as important as the medical or dental care they receive from us.
It should be about love, and that makes the whole difference.
So Clara Barton, after the Baltimore riots and the aftermath of the first bloodshed of the Civil War, Barton is going to go and feel that call to action. And so she begins to amass supplies right here in her boarding house on 7th Street in the center of Washington where she's living.
She solicits her friends and her family and asks them for bandages or any supplies that she can use to treat soldiers.
She is bringing in boxes and boxes and crates filled with supplies. Her problem is that she doesn't have anywhere to take them. She goes to the United States Army, the Union Army, and she asks for permission to go into Army camps. The Army refuses.
Women weren't supposed to be doing that in those days. It was a man's job to nurse.
This is a time period in which women who are close to soldiers are often considered prostitutes or loose women of loose morals.
They didn't want nurses, much less Clara Barton, who was such a small woman in stature and probably a pain in the royal rear, because she wanted something done and would be frustrated when things weren't being done.
And so she is devoted to and dead set on going onto the battlefield herself, delivering her supplies on her own. She travels in this wagon train moving north to Frederick and over the mountains following the armies to Sharpsburg, to the banks of Antietam Creek. And that's where she finds herself early in the morning of September 17th, 1862, as the Battle of Antietam begins.
There'll probably be 40 of us in there when we talk about registration, interpreters, nurses, practitioners, and of that whole group of people, there are 3 that are part-time paid. Myself, our nursing director, and our physician assistant. The rest of those people are all volunteers. We look at every single one of those 40 people as practitioners. Any one of them could have been the person that God picked that day to give that patient the love that they need.
If you're sick and you cannot afford to go to the doctor, that is a very difficult position to be in. And to be able to provide a service where a person feels like they can come and get something that they really need and not have to worry about the cost, I think that's a great benefit.
I started in 01 because I can't afford a doctor.
I'm one of those that don't have the finances to actually be able to get medical insurance.
Many of our patients have chronic kinds of things like diabetes or high blood pressure.
I have high blood pressure in the 200s, which, if anybody knows, that's pretty high. You know, I had no choice but to find someplace to go.
Before I retired, I was thinking, well, what would I like to do when I retired? And I always wanted to work in a free clinic.
And a friend of my mom's knew about this place because her mom came here.
We greet people when they come in, we pull their files, we make appointments.
They don't worry about your income, if you have any or if you don't.
And so we came in one day. You know, you have to walk in here, you know, without an appointment your first time. So you spend a lot of time in here.
You get to know other people, the patients as well as people who are volunteering.
So we're not limited to the confines of how many letters we have after our name, but we're unlimited in the ability of all of our team to be able to provide the love that that patient needs, which can very much be healing not only physically, but spiritually and psychologically too.
I just had my blood pressure checked and it was 120/80, which is back down to pretty close to normal.
It's very energizing to see people and to know that people are getting care that they need.
So it's a great thing.
She decides to take her 3 wagon loads of supplies straight to where the action's going to be.
She is on the edge of the battlefield. It's ferocious combat raging. There are bullets passing through the trees. There are explosions of artillery shells all around. And there are wounded screaming for help.
She finds a farm, gets permission to treat the soldiers, mainly because she has supplies. The key was that she had something that the Army and the soldiers needed.
As the barn that they are using is being shaken by nearby artillery, she writes that even some of the surgeons who are trained and who have been at war for a year plus are running away because they're scared.
I can't imagine what she was feeling, hearing the cannons go off, smelling the gunpowder, Seeing these operations at night by lantern, it had to be overwhelming. It's the bloodiest day in American history.
There are 8,000 casualties within about a 4-hour span of mourning.
I don't think anyone really knew that was going to be what that battle turned out to be.
In that hospital is a surgeon, Dr. James Dunn from Pennsylvania. Days after the Battle of Antietam, he is going to write home to his wife and tell about the incredible things he saw Clara Barton do on the battlefield at Antietam.
We had expended every bandage, torn up every sheet in the house, and everything we could find when who should drive up but our old friend, Miss Barton, with a team loaded down with dressings of every kind. I thought that night, if heaven ever sent out an angel, she must be one. Her assistance was so timely. She distributed her articles to the different hospitals, worked all night making soup, and the next day and night. And when I left, 4 days after the battle, I left her there ministering to the wounded and the dying. When I returned to the field hospital last week, she was still at work, supplying them with delicacies of every kind, and administering to their wants, all of which she does out of her own private fortune. In my feeble estimation, General McClellan, with all his laurels, sinks into insignificance beside the true heroine of the age, the angel of the battlefield.
Her role in the Battle of Antietam, she is giving aid to maybe several hundred people of the 23,000 casualties that will take place during that one-day fight. And she is going to do that over and over and over again during the Civil War and in the decades that follow.
People described Antietam as being totally dead silent. You didn't hear a bird sing. They had all been chased away. It totally devastated that community. Antietam is about 25 miles from downtown Frederick. Many of the wounded ended up walking that distance. The population of Frederick doubled almost overnight with the number of patients that arrived from the Battle of Antietam.
The first day after the battle was over, they had found out we were going to be running out of space. What can we do? We need big buildings. Well, let's go down and talk to the preachers, the different churches here, and see what we can do. And every big building I had. And so that's what they did. They said, we need your space. We need your space for the sick who are coming here.
27 buildings were designated to be hospitals for any of the wounded that needed to be cared for, plus 2 tent hospitals. Frederick became known as one vast hospital. A town of about 8,000 residents nearly doubles overnight, with 10,000 wounded coming into the streets and those buildings and needing immediate care. It wasn't just the Army that responded to all the wounded. It was the citizens as well. They came with anything they could find. They didn't turn a blind eye. They responded by going out into the streets and starting to care for people. It was all unfolding in their neighborhood, right in front of them. They responded by coming out and doing something face-to-face, one-on-one, with care and compassion for their fellow man.
Mission of Mercy is a magnificent role model for the community. One by one, each volunteer comes forward to say, I have skills I can help, whether that's a doctor, whether that's a nurse, whether that's a dentist. These are people who are all working together, but it starts by one person saying, I'm willing to volunteer.
Dignity is very important to people. It's embarrassing for some people to come here and just bare their souls as to their medical problems and everything else. Basically, they're saying, we're asking, we're begging for help. So one of the tenets of Mission of Mercy is to treat people with dignity and make them feel welcome. There's a lot of smiles go on, there's a lot of hugs. Some of the nurses have repeat patients and they'll hug them and say welcome back. We try to make it a very, very comforting atmosphere.
In addition to healing people through dignity, Mission of Mercy is also setting forth a powerful spirit of service in this community to say anyone and everyone can make a difference.
Clara Barton's experience during the Civil War taught her that one person could make a difference. Angel of the Battlefield is just one component of her life. Clara Barton knew that the Army didn't care about the individual. They cared about the bigger picture, the mass movements of men, winning battles. She leaves this space in Washington to go on to form the American Red Cross, who now today responds to mass casualty events, natural disasters, any large-scale casualty disasters all over the world. Clara Barton cared about the individual. Her individual initiatives turned into an organizational initiative, which ended up changing the world. There's such a debate going on now about how to solve the healthcare crisis. Well, there's enough talking going on. If Clara Barton were alive today, she would not be on social media. She would not be complaining on CNN or television. She would be out there on the front lines, just like Mission of Mercy is today.
Where is that value of life? For what people used to do before for someone, they would go out of their way, they would die for someone because they believed in that person.
Every society has to give back to those who are less fortunate. And I've been fortunate all my life, and I just enjoy giving back.
If you look at Mission of Mercy, they're providing an integral component of caring for individuals and communities. There's a need that they are fulfilling that the government is not.
The Sullivans made a decision years ago that they would not take government support. We felt that we can't restore dignity and heal through love if we were focusing on the bottom line all the time. It just would hold us back with our mission.
I think that they need to approach this service as something from the point of view of love. Medical care can be a very big part of it, but the rewards that we get from it are not rewards related to our medical care as much as rewards related to the look in people's eyes or the tears in their eyes.
That's priceless, that's immeasurable. I'm not saying it's a fun service. There's often times you go home, man, and you're just very tired. So when we saw 6 patients, we weren't tired. We were wondering how many we'd see. And then when we got up to 40 patients, it's like, we did 40 today, we can't see any more. And then when it got up to 150, it's like, oh my goodness. And it's just, you're tired. You're exhausted because then you have to get ready for the next day, and then you have to follow through, and you have to have the continuity of care. It's not like you come and then we'll see you again whenever. No, it's just not a one-time thing. It's an ongoing service until we can get you on your feet again, and then the hope is that you'll turn around and help someone else. We're all different in many ways, but we can respect and love one another. That's the whole essence of Mission of Mercy. And when they're loved and treasured, then the boundaries and walls of fear and anger just kind of crumble.
Our doctors come and they volunteer because they say to us, I love being here. This is why I went to medical school. I can now practice pure medicine again.
We look at healthcare as being a way to fulfill addressing the need in the community.
Having a community spirit is essential to really having a healthy community.
It's a family networking to make us stronger, to grow stronger, to reach out more.
You have to all be pulling together, rather than tearing each other apart.
I think that's it. There has to be a desire to serve, to respect the dignity of people, and be willing to take a risk.
And people have to buy in. You have to have the right team of people who want to roll up their sleeves and work. And that's taken about 25, 26 years to do that.
Clara was always about something much larger than herself. If you can meet the basic need of restoring physical health, you will have at the same time restored dignity and their hope. And that's what Mission of Mercy is all about.
You sit in the waiting room and look at the patients' faces before they walk onto the medical van, and then you look at them after they come off. I mean, it just says it all.
The level of care is one thing, which is great, but the way they treat you here is amazing.
All the people here are excellent, very friendly.
Very nice people. Nice doctors, nice people, nice atmosphere.
As many people as they see in all the different locations, as soon as I walk in the door, they know me by name.
I mean, they take care of you here.
This is a plus for Frederick, believe me.
And without them, I don't know where I'd be.